Just finally got to the point where I thought maybe it's time for me to try to lose some of my weight.
Hi, my name's Cynthia Wells. I'm an employee here at the Community Health Center of the North Country. I do insurance enrollments through the exchange. I do outreach for all 4 of our health centers, and I'm also the diabetes self-management class educator, and we have 3 trained staff to run the diabetes self-management program. We offer classes in all 4 of our health centers. Just here in St. Lawrence and Franklin County, so many of our patients have type 1 and more type 2 diabetes. We're seeing that more and more just because of, the way people live. Their lives are busy. They eat so much fast food, much more than we did when we were children. So it's all about being aware of what we're eating and what is a more healthier lifestyle. The class is a 6-week program. It's about 2.5 hours long. We have chronic disease self-management book, and the class is held accountable for weekly action plans. It's a wonderful program. I find I do much better with my lifestyle when I teach the class because I'm also held accountable to the weekly action plans, and as an educator we get so much out of teaching our classes, and we meet these wonderful lifelong friends. For one of our students, I was teaching with one of our providers this last class, and it was Christine's idea that we do a weekly action plan, and I think we're going to incorporate this more and more as we move forward. One of our patients, he has trouble with literacy, so we all came together as a class, and for week 4 for our action plan, we all brought in a healthy food product, and we had a class meal together, and we built it around Terry's meat for the week, and it was a wonderful experience. People made healthy choices, and the meal was delicious, and nobody felt they were missing anything from it tastes wonderful. So we proved to each other that we could cook a very healthy meal and still enjoy the contents of it. This program is so important. We want people that are diabetics to get their A1Cs lowered. Everybody knows how dangerous diabetes is to your health, your kidneys, you're in jeopardy for heart failure and everything else. It's all about just getting up and just moving more, even if it's just standing up while you're watching TV or getting up and moving around. It's just making everybody more aware of what actions they're doing, be it eating, moving, getting up if you're sitting at your desk, if you're working, go print at the furthest copier in your building just so you get up and move. That's the whole idea. And just raise awareness. Don't drink that soda. Have a seltzer, throw some cranberry juice in it.
Well, my name's Terry Holmes. I lived here in Canton a good share of my life. I'm diabetes and stuff, and I'm overweight and stuff, and I just finally got to the point where I thought maybe it's time for me to try to lose some of my weight, and which I've lost some and stuff, and I check with the scales every now and then that I got to home to make sure that I'm losing, but sometimes I get knocked off the wagon and I wind up gaining back a little, but I'm trying to stay with it now because I get tired of being fat and out of shape and hard to breathe and everything else for myself. So that's why I wanted to get in the programs with these ladies and stuff and see if there's some way that I could change my eating habits and stuff. And I have changed some. Not much for cooking. I can make soups and stuff and cook macaroni and stuff like that, easy stuff, and hamburger. But when it comes to baking, I am no good at it. And I made that meat and cooked it, and it came out a whole lot better than I thought it was gonna. So now that's what I'm gonna do, and I made some macaroni and stuff with some cheese melted on top of it when I put it in the oven here just not too long ago. And it came out really good and stuff, and I was pretty proud of myself. And I'm gonna be a lot more prouder when I learn how to do this other cooking, and don't be so afraid of my oven and stuff, because that's what I think my problems was, to do it. I go to the farmer's market now and then to buy stuff. It's surprising of the people that you meet and stuff, and a lot of people is very friendly and nice. And they have a lot of different things out there, squash and potatoes and tomatoes, and there's all kinds of vegetables out there that's supposed to be good for you.
He's doing the $2 chocolate.
Yes. 132 bundles.
This is
That would get you even.
Yeah, that'd be
4 bundles.
Yeah,
That would make you even.
Which is, I need.
One of the most important things people take away from the class is, you know, our patients will say, I never knew how many carbohydrates were in bread and pasta, and you know, spaghetti squash is just as good as pasta, only people are afraid to even try it. So I think for one of our next classes for the action plan, we'll do an introduction of spaghetti squash and compare it to a whole wheat pasta. So just, you know, be so aware of what you're putting into your body, because we want you to live a long and healthy life, especially as our patients. We like to see them do better. Anyone can take the program. At all of our health centers, our providers have a prescription pad that they can recommend that our patients take the class. We have an education component in the prescription, so the providers can just circle whatever class that the patients can take in Malone, Canton, Ogdensburg, or Gouverneur. And the class, anyone can take the class. You don't have to be diabetic or have a chronic disease to take the class. We have a lot of spouses of diabetics or partners to take the class with their spouse, and that way they can work on the problem together. So there's absolutely no charge for the program. We have this wonderful grant from Excelis that's paying for the class, the snacks. We're hoping to get the cooking classes going. We just have to find a space for those, which is a continuum of the class. So people learn to cook healthy meals and then take 2 healthy meals home for them that they can put in their freezer. And if people have transportation problems, we can certainly help with getting you to the classes, because we want you there and we want you to be successful in managing your diabetes.
I'd recommend it left and right to anybody and everybody that's out there. Please do come and join it and get into it and try it. You'll be surprised. You'll meet a lot of nice friends. Like I say, you'll feel 100% better for all the weight you can lose. It makes a big difference in your life.